Ep 53, How to Keep Your Teeth and Gums Healthy After 60. Oral health is one of the most overlooked aspects of healthy aging, and one with surprisingly far-reaching consequences. The connection between the mouth and the rest of the body is far more significant than most people realize. Severe gum disease, periodontitis, is independently associated with cardiovascular disease, diabetes, rheumatoid arthritis, respiratory infections, and Alzheimer's disease. The bacteria that cause gum disease enter the bloodstream and drive systemic inflammation throughout the body. After 60, several changes make oral health more challenging. Reduced saliva production from aging and medications, gum recession, worn enamel, increased medication burden affecting oral health, and often reduced manual dexterity affecting brushing and flossing quality. Today, we're covering the most evidence-based strategies to maintain oral health in later life. Dry mouth, xerostomia, is extremely common in older adults, primarily because over 500 commonly prescribed medications list dry mouth as a side effect, including antidepressants, blood pressure medications, antihistamines, and diuretics. Saliva is essential for oral health. It neutralizes acids, washes away bacteria and food particles, and contains antimicrobial proteins. Chronic dry mouth dramatically increases decay risk. Gum recession exposes the root surfaces of teeth, which lack enamel protection and are highly susceptible to decay and sensitivity. Recession is often the result of accumulated gum disease, aggressive brushing, and aging gum tissue changes. Enamel wear from decades of use, acidic foods, and sometimes tooth grinding, bruxism, leaves teeth more vulnerable and sensitive. Tooth loss, while rates have improved significantly with better dental care, tooth loss in older adults affects nutrition, ability to eat a varied, nutrient-rich diet, speech, confidence, and social interaction. Brushing. Twice daily, for 2 minutes each time with a soft bristled brush. Electric toothbrushes are significantly more effective than manual brushes for plaque removal and are particularly helpful for older adults with reduced grip strength or dexterity. A rotating oscillating electric brush removes up to 21% more plaque than a manual brush. Technique. Place the bristles at a 45-degree angle to the gum line. Use gentle circular or vibratory motions rather than hard scrubbing. Hard horizontal scrubbing causes gum recession and enamel abrasion. Fluoride toothpaste. Use a toothpaste containing at least 1,000 ppm fluoride, standard adult toothpastes. For high-risk individuals, prescription-strength high-fluoride toothpaste may be appropriate. Ask your dentist. Interdental cleaning. Flossing or using interdental brushes once daily removes plaque from between teeth, an area the toothbrush cannot reach. Interdental brushes are often easier to use than floss for older adults with reduced dexterity and are equally or more effective at removing interdental plaque. Gum disease begins as gingivitis, inflammation and bleeding of the gums caused by plaque accumulation. Left untreated, it progresses to periodontitis, destruction of the bone and ligaments supporting the teeth. Periodontitis is the leading cause of tooth loss in older adults. Signs of gum disease. Gums that bleed when brushing or flossing, red or swollen gums, persistent bad breath, gum recession, loose teeth, or changes in bite. Professional cleaning, scaling and root planing, removes the calcified tartar that cannot be removed by home brushing. For older adults with established gum disease, cleaning every 3 to 4 months rather than the standard 6 is often recommended. The systemic connection is important enough to repeat. People with periodontitis have twice the risk of cardiovascular disease, significantly worse blood sugar control if diabetic, and higher rates of pneumonia from aspiration of oral bacteria. Review medications with your doctor. If multiple medications causing dry mouth are being taken, ask whether any can be changed or reduced. This is often not possible, but worth asking. Hydration. Sipping water frequently throughout the day, particularly during meals, helps compensate for reduced saliva flow. Saliva substitutes and stimulants. Biotin and similar products provide artificial saliva relief. Sugar-free xylitol chewing gum stimulates residual saliva production. Xylitol also has antimicrobial effects against Streptococcus mutans, the primary decay-causing bacterium. Chew after meals for 20 minutes. Avoid alcohol-based mouthwashes, they dry the mouth further. Use alcohol-free formulas. Avoid mouth breathing. Breathing through the mouth dramatically dries oral tissues. Treating nasal congestion reduces mouth breathing. Regular dental visits, at least annually, ideally every 6 months, allow early detection of decay, gum disease, and oral cancer, all of which are far more easily treated when caught early. Dental anxiety should not be a barrier. Discuss it with your dentist, as options for anxious patients are widely available. Oral cancer screening. Oral cancers are significantly more common in older adults, particularly with a history of smoking or alcohol use. Dentists routinely check for suspicious lesions at checkup appointments. Nutrition for oral health. Calcium from dairy, fortified plant milks, leafy greens, and vitamin D maintain the bone density supporting the teeth. Vitamin C is essential for gum tissue integrity. Limit acidic foods and drinks, particularly carbonated beverages, and rinse with water after consuming them. A healthy mouth is not merely about teeth. It is about comfort, nutrition, confidence, and whole body health. The mouth is the gateway to the body, and its health reflects and influences the health of everything connected to it. Brush well. Clean between the teeth daily, manage dry mouth, see your dentist regularly, and think of oral health as the whole body health investment it genuinely is. See you in the next video.